Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon and founder and creator of KaramMD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very exciting and very interesting topic that is trending all over the internet, and that is buccal fat removal for people who are in their 20s and 30s. And today I'm going to go through discussing everything there is to know about this topic so you can make an informed decision. And if you're not in the market for having this done, I think you'll find it interesting anyway, because it really does speak to the concept of trends in cosmetic surgery very, very carefully, and it kind of discusses these things so that you can be very aware of information that will be coming at you from all different places and put everything into perspective so you can critically analyze trend topics and hot topics and things that are happening in the realm of cosmetic surgery, and see whether or not they apply to you by using this basic sort of algorithm of discussion. All right, so let's break it down. Here are the topics that I'm going to talk about. Number one, what is buccal fat removal? Number two, what's the history of buccal fat removal? Number three, what are the results that people are seeking to have when they get buccal fat removal? Number four, is it recommended for all facial types and all ages? You'll understand why and why not. Number five, what should you know before considering having buccal fat removal? What are the risks involved in this procedure? And number six, what happens with age if you've had a buccal fat removal, and what happens with age if you've never had a buccal fat removal? This is really important to know, especially if you're in your 20s and 30s and trying to anticipate whether or not this is the right procedure for you and how this could play out in the long run. Number seven, what are some alternatives to buccal fat removal that are non-surgical that you may consider? And number eight, what is my opinion on buccal fat removal in 20s and 30s? I think if you know me already, you might not be super surprised by the answer to that, but if you don't, you may be surprised. I think it's a very interesting perspective on the topic. All right, so stay tuned for that. All right, so let's discuss what is a buccal fat pad removal. First, we got to know what the buccal fat pad is. So remember, the face is defined by the skeleton, the skull, the facial bones, the cheekbones, the jaw bones, all these different areas. Now, if it was just skin on bone, obviously we know kind of what that would look like. It looks very gaunt, it looks very skeletonized. So what Mother Nature has done for us is soften the effect by putting fat pads in critical areas where bones have concavities. So for example, in the temporal fossa, there's a temporal fat pad. Underneath this region here, there's the buccal fat pad, so underneath the natural cheekbone. Under eyes, above the eyes, have fat pads. All these areas soften the bony structure of the face and give the face a soft contour, which in many ways is analogous to looking youthful, but also looking healthy. Now, in some cases, the fat pads may be considered too full, or in some cases, they may be considered too gaunt. So there's different remedies for each of these considerations. So basically, what a buccal fat pad is, very specifically, is the fat pad that lives underneath the cheekbone. It is responsible for giving the face the contour from the mid-face down to the lower face. This section underneath the bone to the jawline. Basically, some of that transition between bones is going to occur because of the buccal fat pad. It's fundamentally a little bit bigger than the size of a walnut, and it disperses into this natural space. Some people have a little bit of a larger one, some people have a little bit of less of one, but at the end of the day, that's where it lives. Now, is this concept of removing or trimming the buccal fat pad new? The answer is no. It's important to put this into perspective. Historically, I'm talking 80s, 70s, this was a big procedure, and it was being done very commonly for women who wanted to look like the models that were being displayed back then. They were being portrayed in magazines and covers and things like that, where they had very high cheekbones and a very gaunt or narrow portion of the face, this kind of cheek area. And that look that was considered highly attractive, became kind of the impetus for buccal fat removals, and it was being done left and right back then. Now, it took a little while, but the trend kind of changed. This pendulum sort of swung where we felt that actually a gaunt face was not attractive or not necessarily ideal, and a face that was fuller was the ideal. So interestingly, from the 90s and probably until now, there was kind of an overemphasis on fullness. And that's where fillers and different things like that came into place, where they're putting volume in all these different areas to fill that area. So anyone who had hollowness or gauntness in this region as they age was getting it filled with fillers or fat transfer, interestingly. So the trend basically of buccal fat removal in the 70s and 80s kind of died out and gave way to volume augmentation, adding volume. And now we're kind of, we're going back to looking at this area and saying, maybe we should go down this one. And same thing. Now it's all social media, TikTok, celebrities, influencer models, those folks who are out there displaying these changes, some of them admitting to the procedure, some of them not. This is the look that is now catching on and creating a tremendous demand and interest, again, in the removal of the buccal fat band. So the history is very important to keep in context as you're deciding this. I basically gave the answer to the third point, which is what is the look that people are going for? And as you can see by some of these images here, the look that people are going for is a more hollowed out section of the cheek. And this, again, when you're in your 20s and 30s, the natural look is for you to have fullness in that area. Most people have fullness, unless they either naturally have a lot of volume deficiency in this area, or they have extra high cheekbones that gives the face a more narrow look down here. But most people in their teens and 20s and 30s have fullness in this area. It's not until you get a little bit older that the natural transition starts happening, where it gets a little bit more volume deficient in that space. So keep this in mind, and we'll come back to that in a second. So number 4, is this look, is this surgery something that everyone is a candidate for? Can anyone have that particular look that we're seeing on the internet and social media? And the answer is no. And there's a lot. So the face is a very interesting thing. It's not like you can take beauty standard from one era, apply to another area, look at a beautiful face that someone has and say, I want those exact same features. It's so dependent on all the other features of the face that if you try to emulate one part or the other, you're going to end up creating a face that doesn't necessarily look completely right. So for example, somebody who's already pretty narrow in the face, who has a pretty hollowed out face, that person gets a buccal fat removal, they're going to look sickly. They won't look attractive. You get a person that doesn't necessarily have that high cheekbone, which not everyone does, and you remove that area, now the face is going to look really thin and hollow, as opposed to more triangular, right? So there's a number of nuances that really have to be taken into consideration. This is where your relationship with your plastic surgeon is so important, because they need to guide you in the right direction based on your facial type to decide whether or not you're a candidate for it or not. Now, I'll just tell you this, people who naturally have a very full face, who are otherwise very thin, but have a very full mid-face here, those people potentially are good candidates for the procedure because their face doesn't match the rest of them. And their mid-face or this cheek area doesn't match even the rest of their face. So there's a time and a place for these procedures, but you have to be very deliberate about choosing who gets it and why you would get it, and whether you're a candidate. And this is very, very important to understand. The specifics of your face have to be carefully discussed with your plastic surgeon before just jumping into a procedure like this. Because unlike fillers, unlike Botox, once you remove the buccal fat pad, it's gone. It's never coming back. And you can't necessarily emulate the effect of a buccal fat pad by putting fillers or fat transfer in spaces that are not normally filled with volume. So for example, when you put fillers or fat transfer, you're not putting it into that deeper space where the buccal fat pad normally lives, right? So this is very important. The buccal fat pad's an encapsulated fat, very organized into a specific area. You can't just fill that area, because when you fill it, you're putting in fat more or less in the subcutaneous space. It's rare to be able to put it into that exact same area that the fat was removed. So that's really important to keep that aspect in mind. It's permanent, so be careful about this. So what should you know about the procedure and what are some of the risks? So I've already alluded to one of them. One of it is it's permanent. Number 2, there are very important parts of the anatomy in that area. There's the salivary duct that goes from your parotid to your cheek. There are facial nerves in that area. There's also blood vessels that can bleed and create hematoma. There's, of course, there's the entrance into the mouth where you could end up getting an infection. Now remember, how is the buccal fat pad removal done? Typically, it's done by making a small incision on the inside of the mouth, and then from there you get into that encapsulated fat pad and you remove it. So buccal fat pad removal, generally speaking, is done intraorally, so no external incisions. And when you do it on the inside of the mouth, those are the potential risks. Now, overall, pretty low risk procedure, especially in trained hands who knows what they're doing with it. But nevertheless, these are risks that you're taking. The biggest one of all is the permanence that I just mentioned before. Once it's gone, it's gone. You cannot get it back. You can't retain that shape. If you don't like it, you're done. Like it's very difficult to fill in the space where the buccal fat pad is removed. Keep that in mind. So you've got to make sure you're a candidate for it. So number 6, this is the big one. This is the one I think really needs to be taken into careful consideration. So as we discussed, when you're in your teens, everyone's got a baby face. When you're in your 20s, the baby face continues. When you get into your 30s, you start seeing some of that baby fat, that fullness start to dissipate, and you start to see the face get more and more hollow. Now, this is the tricky part. You know the natural trend is to lose volume in this area, right? So we naturally will lose that roundness that we see in teenagers by the time we're in our 30s. Mid-30s is usually when people love their face the most. That's just kind of a general perspective that people look at themselves in their 30s and say, I love my face in my mid-30s. Of all the ages, they like it more. We're a little bit more chiseled, a little bit more structured, a little bit more elegant, less full, etc. You know a 20-year-old is headed in that direction. What happens if you take out the buccal fat pad before then? Well, now when the natural volume loss happens, you might be in a position where your face looks too hollow now. Now, that's a problem because difficult to replace that. Now it's going to become sickly and unattractive to be that hollow into that area. So the natural loss will get you to the desired level if you're patient. But if you jump it, you're going to end up potentially being too hollow by the time a decade goes around if you're getting it done in your early 20s. So keep that in mind. That's a very, very important understanding to go. Now, that's always been my perspective because, as you know, I'm a facial rejuvenation surgeon and I restore volume. So I see people who are a little bit older, they've lost the volume. We put a little bit of volume back into that area, but most of my patients haven't had their buccal fat pad removed because these are, we're almost like skipped an entire generation where that trend existed. Now most of these people are much older and they haven't, they're not even in a position to get these procedures done per se. So number 7, what are some alternative approaches to getting the look that you're hoping for without necessarily having to remove the buccal fat pad? And this is, I would say, very important as well. And I'll get to my overall opinion on it in a moment. But here's the thought. The look you're going for is a higher cheekbone, more slender lower face. Well, not that I'm a huge proponent of putting a lot of volume into this area, but if you want some of that look, especially if you're going to follow a trend, put in a little bit of voluma, some type of firmer filler into this area to give yourself a little bit higher cheekbone effect, to give yourself that kind of angle look without necessarily removing this area, right? Removing the fat pad. So you can get some of that look. Now, I wouldn't recommend doing too much of that or doing it for too long because keep this particular point in mind, these fillers do last and they really do build on themselves pretty soon before you know it. If you're doing this for like 5 years, 6 years, 7 years and beyond, you're gonna end up looking a little avatarish, a little bit too full in this area. So a little, what I mean is a lot. So be very careful. I mean, you want to, this trend is a trend. So by the time we, 2-3 years rolls around, it'll probably not be a trend anymore. Just like the fox eye and cat eye and, all these different big lips and all these last for short periods of time. So if you want to kind of play around with it, that's as far as I would go. The safest thing to do is look up some makeup contouring approaches that give you some of that effect in this area. Makeup artists nowadays are so incredibly talented and gifted about how to use makeup for contour. Use some of that type of an effect to establish the look that you're going for without necessarily having to cross a bridge that and burn it. So those are 2 basic ways you can establish that while you ride out this trend if you want to participate in it. All right, guys, so here's number 8. What is my opinion on buccal fat removal on 20s and 30s? I think you're getting the point from everything that I've said up until now, that generally speaking, I think there is a time and a place for it. I think there are people that look excessively full in this area that have overzealous amounts of buccal fat pad. Trimming a little bit out of there isn't going to create a huge problem. Part of that is dependent on how the surgeon is, right? I mean, taking all the buccal fat pad out or taking too much out can create a problem in any face. This is where artistry and talent comes into place, like everything else we do in plastic surgery. But there's definitely candidates who are very full, in their cheeks, who are very full in their neck, yet they're, generally speaking, they're at the ideal body weights. It's just the way the face is. And cosmetically, I can understand that, and I think there's a place for it in those particular scenarios. If you're doing this because you're seeing some of the trends and you're seeing some of the images that we showed here and some of the images that you see on the internet, I would warn you not to follow this trend. I've been asked about buccal fat removal, throughout my entire career. It's just becoming more and more popular now than it ever has. My strong opinion on the subject is you're going to lose that volume. You're going to regret taking more of it out later on, because when the face looks gaunt, it just doesn't look pretty. And when it gets real gaunt, it just looks sickly. It looks tired. It looks malnourished. That's the effect that you get when you age with buccal fat removal. Difficult to restore, difficult to replenish that architecture. So from my point of view, I would stay away from it if you're in your 20s and 30s. I would fundamentally stay away from it if you are following a trend. Trends in cosmetic surgery never end well and they never last. That's really important to understand. Even the trend that we've had with the fillers is dying away. I mean, truly dying away. People are putting less and less volume into their face or staying away from fillers because they've seen so many faces become overfilled as a result of it. So that trend is also dying. The bottom line is beauty, it's about balance. It's about, literally just staying the course of time. It's not something that comes and goes. It's not really that based on whatever is being portrayed in a certain period of time. It's timeless is what I'm trying to say. And if you're trying to create these changes to create a particular look, like back in the days that every nose was upturned and highly sloped. This was an 80s rhinoplasty. Now it's like that's the worst rhinoplasty you could ever have. Now everything's trending towards natural in that area. The face should be treated the same way. So don't follow these trends. Don't look at these things as ideal. Your face is your face. Your face has its unique look, and your surgeon and your relationship with them has to be very high level and very trust that you offer the suggestion, listen if you're a candidate, and do your own homework and investigation because your surgeon might be wrong as well. Videos like this, counter arguments to certain trends, listen to it with an open mind and open heart, and then decide what's right for you. But my opinion in general is the following. Certain people are candidates, most people are not. In the people who are candidates for it, like anything else, is a tool in the toolbox, great thing to do. People who are not, you'll regret it. And I don't want you to regret it. All right, folks, I hope this helped. I hope this put everything into perspective. This is I would say probably all you need to know about the particular topic. Send this along to some friends, some family, and if you like it, comment. Any questions you have below, I will do my best to answer it. And if you haven't already, make sure you subscribe to this channel so you can get more content like this, which we put out a couple times a week. All right, folks, thanks so much. Looking forward to hearing from you and sharing more with you. Dr. Amir Karam.